Module Overview. Repositioning and turning patients at regular intervals is a critical aspect of bedside care. The consequences of neglect in this area can be severe, including the development of pressure ulcers, bed sores, reduced circulation, muscular atrophy, skeletal deformities, nerve compression, and even systemic infections like sepsis. This module delves deeply into the science of pressure distribution. Postural biomechanics. Turn schedules techniques for movement with and without assistive devices, pressure sore prevention, classification, and management. Bedside caregivers are on the front lines of this responsibility and must be equipped with both knowledge and technique. Understanding pressure ulcers. A pressure ulcer, also known as decubitus ulcer or bedsore, is an injury to the skin and underlying tissue primarily caused by prolonged pressure, especially over bony prominences. It most commonly occurs in patients who are immobile, unconscious, paralyzed, or heavily sedated. Key pressure points: sacrum, lower back, heels, elbows, shoulder blades, hips, ankles, occiput, back of the head. Contributing factors: friction, shearing, moisture from incontinence or sweat, poor nutrition, diabetes, or poor perfusion, long periods without movement. Stages of pressure. Ulcers. NPU AP classification. Stage description. Stage 1. Non-blanchable redness on intact skin. Stage 2. Partial thickness skin loss, involving epidermis and/or dermis. Stage 3. Full thickness skin loss with damage to subcutaneous tissue. Stage 4. Full thickness skin and tissue loss with exposed bone, muscle, or tendon. Unstageable, obscured, full thickness skin and tissue loss, Slough Escher present. Note: early recognition and intervention are key to preventing progression. Repositioning. Why and when? Regular repositioning helps relieve pressure on vulnerable areas, enhance circulation and oxygenation, maintain musculoskeletal alignment, prevent contractures and stiffness, reduce risk of bed sores. Standard turning schedule. Every 2 hours for high-risk patients. Alternating positions: supine, left lateral, supine, right lateral assessment. Before turning: skin integrity check, level of consciousness, body size and fragility. Tube placements: IVS, catheters, feeding tubes, pain level and comfort. Safe techniques for turning and repositioning. Key principles: use of draw sheets to reduce friction. Maintain neutral spine alignment. Always explain the procedure to the patient, even if unconscious. Use team approach for heavy or fragile patients. Bed breaks engaged before movement. Place pillows and wedges to support posture and prevent rolling. Common techniques: log rolling for patients with spinal concerns, pivot turning in sitting transfers, one-person turn for cooperative, lightweight patients, two-person or mechanical lift turn for bariatric or non-cooperative patients. Equipment used in repositioning. Device and purpose will be used a table. Draw sheet reduces friction and shearing. Slide board. Lateral transfers. Trapeze bar assists patient in repositioning themselves. Turning wedges. Pillows. Prevents rolling and maintains body angle. Pressure relieving mattresses distribute pressure evenly. Air fluidized beds, ideal for stage 3/4 ulcers. Each tool must be disinfected, checked for functionality, and used according to standard infection control protocols. Preventive strategies for pressure, ulcers, skin inspections during every turn, moisture control, incontinence pads, barrier creams, optimizing nutrition and hydration, use of pressure-relieving surfaces, early mobilization whenever possible, documentation of repositioning including time and body position, education of caregivers and patients. Documentation and communication. Document: time of each reposition area inspected and skin findings. Equipment used. Pain experienced, response to repositioning. Communicate: redness or breakdown signs to nurses. Patient complaints of pain/numbness. Changes in mobility or response. Legal and ethical considerations. Neglecting to reposition patients can constitute negligence or malpractice and may result in institutional penalties, legal suits, complications, or patient death. Caregivers must be accountable, consistent, and proactive in preventing pressure injuries. Empathy and vigilance are non-negotiable.